Every 33 seconds, someone dies from heart disease in the US. And yet 1 in 5 heart attack victims never feel chest pain. That means right now someone could be having a heart attack and they don't even know it. No dramatic chest clutching. No falling to the floor. Just a strange fatigue. Maybe a tight jaw. Maybe shortness of breath walking up stairs that never used to feel steep. What if your heart isn't screaming but whispering? A 45-year-old woman walks into the emergency room. She's not gasping for air. She's holding her jaw. She says her neck feels tight. She's been feeling off all week, exhausted, dizzy, maybe a little nauseous. The receptionist thinks it might be anxiety or the flu. But an hour later, she's rushed into cardiac care. She was having a heart attack all along. That could happen to anyone. Because heart disease often doesn't look like what we've been taught to expect. We think it'll be loud, painful, obvious. But it's usually quiet. Subtle. Creeping. Jaw pain, especially on the left side, is one of the most ignored warning signs. So is neck tightness, shoulder pressure, or a strange feeling in your upper back. You might think you slept wrong, but it might be your heart asking for help. And women? They're even more likely to experience these non-traditional symptoms. For decades, heart disease was studied mostly in men. As a result, women have been misdiagnosed, dismissed, or simply unaware that what they're feeling could be their heart in trouble. Fatigue that feels crushing. A strange sense of anxiety that comes out of nowhere. Sweating even though it's not hot. These are heart attack symptoms, just not the ones we see in movies. And that's the problem. We wait for the Hollywood version. But your body might already be trying to tell you the truth. Think about the last time you felt drained. Not just tired, but that deep, body-heavy fatigue where even lifting your legs feels like effort. Maybe you used to climb stairs easily, but now you pause halfway. Maybe your evening walks have gotten shorter. You're not lazy. You're not just aging. Your heart might not be pumping efficiently. And when your muscles don't get enough oxygen, your body starts rationing energy. A lot of people ignore this kind of fatigue. They blame work stress, poor sleep, or getting older. But it's one of the earliest and most important signs that something deeper could be wrong. Especially if it's new. Especially if it's paired with dizziness, shortness of breath, or a feeling of pressure that comes and goes. Imagine walking uphill and feeling your chest tighten, not with pain, but pressure. A slight squeeze. You stop to rest and it fades. That's not coincidence. That's your heart struggling to keep up. It's called angina and it's your warning bell. Most people ignore it until it becomes full-blown chest pain. But by then, the damage may already be happening. And this next sign might surprise you. Erectile dysfunction, yes, ED is often a cardiovascular problem. Why? Because the arteries in the penis are some of the smallest in the body. If those vessels are struggling, it's likely the larger arteries, like the ones leading to your heart, aren't far behind. Studies show that ED often appears years before a cardiac event. It's like a crystal ball. But instead of investigating the root cause, many men just take a pill and move on. That's treating the smoke while ignoring the fire. And while we're busting myths, here's a big one. If your cholesterol levels are normal, you're fine, right? Not always. Cholesterol is important, but it's not the whole picture. Inflammation plays a massive role in heart disease. That means someone with good LDL numbers but high levels of CRP or IL-6 could still be at serious risk. You might walk out of your annual checkup with a clean bill of health even though your arteries are quietly inflaming. Don't just look at cholesterol. Ask your doctor about inflammation markers. Because what you don't test, you can't catch. Thankfully, we're living in an age of better diagnostics. One of the most powerful tools we now have is the CT coronary angiogram. It's a non-invasive scan that gives a 3D image of your coronary arteries. It can detect plaque, blockages, and narrowing long before symptoms show up. No catheters. No guesswork. Just clarity. If you have a family history of heart issues, or if you're feeling off despite normal labs, this scan could literally save your life. And your neck? It holds clues too. The carotid arteries carry blood to your brain. If they're clogged, your risk of stroke skyrockets. One warning sign is temporary vision loss in one eye. It's called amaurosis fugax. Sounds scary, right? It is. But most people shrug it off because it goes away quickly. But that moment of blurred or lost vision could be your one and only warning before a major stroke. And then there's sleep apnea, another underestimated culprit. You might think it's just snoring or bad sleep, but it's much more dangerous than that. When your breathing stops repeatedly during sleep, your body goes into panic mode. Blood pressure spikes. Your heart gets stressed. Over time, this damages your cardiovascular system. People with untreated sleep apnea have a much higher risk of high blood pressure, arrhythmias, and even sudden cardiac death. If you snore loudly, wake up gasping, or feel exhausted even after a full night's sleep, it's time to get checked. A simple sleep study can reveal a lot. All of these signs, whether it's jaw pain, fatigue, ED, vision loss, or bad sleep, are your body waving a red flag. Don't ignore it. Let's be clear. Heart disease is still the #1 killer worldwide. But it doesn't have to be. Not when we have the tools, the research, and most importantly, the awareness. Start paying attention to what your body is trying to tell you. Don't write things off just because they don't fit the classic symptoms. Get curious. Ask your doctor tougher questions. Push for better testing. Check your inflammation. Consider advanced imaging if you have risks. Advocate for yourself. Because sometimes, the most dangerous thing isn't pain. It's silence. If you found this helpful, or if you think someone in your life needs to hear it, share this. It could start a conversation that changes everything. And if you haven't already, subscribe. We've got more real talk about real health coming your way. Because understanding your body isn't just power, it's protection. And your heart deserves both.